everybody can see it. Okay, over to you, Sneha.
Yeah. So, firstly, we start with menopause. What is menopause? So, it is, with the name suggests, it's monthly cessation, end of reproductive life. So, basically, that monthly periodical cycle that we usually have, that comes to an end. So, for most of the women, this is a very blessing, but some have a lot of issues during this phase. So let's quickly see what are the phases of menopause and how it comes to a... Okay, so now let's quickly start with premenopause. So premenopause usually starts before 40 years of age. So during this phase, like it is just the menopause phase is just it's just the start of it. So for few women, it starts before 40 years, and usually it is ignored, or I can say people are like women are unaware of this phase, because that particular period, the women are mostly busy. They have busy lifestyles, or due to many different reasons, usually this particular phase gets ignored. But there are a lot of changes that takes place. So we'll come to that later. So perimenopause. Perimenopause is, there are lots and lots of physiological changes. And this is a very critical period in everybody's life, all the women's life. I would say actually all the complete family goes through this. But at the end, you will also understand how. So it is... like usually the end of reproductive capacity. So there are a lot of hormonal changes that takes place during this process. There are bodily, not only physical changes, but the overall body throws a lot of changes. And it's sometimes a confusion state wherein, women also are like unaware that what is happening with me, what is this, I was never like this before. What all things are happening in my body? Now we'll come to the next one, is menopausal phase. That is the end of menstruation. That is usually comes between age of 45 to 55 years of age. We can say 50 years should be the end. For some women, it might be a little later. And post-menopause is just experiencing 12 consecutive years without period. So basically menopause or post-menopause, whatever you say, that's same. We'll quickly go to the next one. So how do we deal with this? Now, when we say there are a lot of hormonal changes, what is this hormonal changes? How does that affect us? How is it's that important to understand that those hormonal changes? So there is like estrogen and progesterone in our body, which otherwise also usually, if it is low, then also your body tends to have a lot of issues. So during this menopausal phase, that is premenopause and menopausal phase, usually your body has this decrease in these two important hormones. What happens during this? So I think most of the women are going through this, and they will be the best person to tell me if anybody wants to share their experience regarding what exactly they are going through. You can unmute yourself and you can share, if at all, if you want to.
You can also put it on the chat box. Okay, someone's talking.
Yeah. Hi. So tell me.
Hi. Honestly speaking, it just the perimenopausal phase kind of really hit. I don't know what was there in the pre-phase, because till then the periods were going on totally regularly, a 28-day cycle. But what I started experiencing was a complete loss of energy. I'm a very energetic person otherwise, and a working person. So, running around here and there, traveling, everything. Complete loss of energy, hot flushes, night sweats, loss of sometimes memory, insomnia, mood swings. So I think I've faced all the possible jitne bhi hote hain, all of them, and it took me at least 6 months to even accept that something like that was happening, you know, because first time I missed my periods was for about 2.5 cycles, and then I'd seen a gynec, and then I said, this is what it is, but I don't want to go on any hormones. So now it's been 3 years, but I'm still dealing with it with great difficulty.
Okay, that's amazing. Very beautifully you explained your issues. So is there anybody else who wants to discuss?
Yeah, hi. I'm Sumita. I'm 47 years old.
Yeah,
I'm
Sumita.
still having my periods. I've not missed them. But what I've noticed is that the flow is not the same as it used to be earlier. So it's still 5 days, but you know, the last 2 days are just a trickle. So the flow has reduced. It's not that they have stopped. But so I, again, not able to put a finger or whether it is, you know, pre-menopause or something, because during COVID, you know, we had to take a lot of those medicines, which also I feel added. So I've suddenly gained weight over last 3 years, not been able to take that off. So I think that's the biggest concern, that as to how to lose this weight, which is because I was always fit. When I would exercise, I would get back into shape. Now nothing works, no diet works, no exercise works. It's very difficult to take it off. And of course, you know, now for last 6 months at least, I've noticed that about when I'm having my periods, just about that time or during the periods, I have this loss of energy. At least once in a month, maybe one day before the period starts, I feel totally energyless. Can't do anything. I have to rest.
So I understand what you must be feeling. So to understand this better, see, when we say there is hormonal changes and, you know, the levels go down, so these are the symptoms that you must have read it on, like, you know, online or somewhere, or doctors must have mentioned it to you all. So there are many more things that your body, you know, have brings changes in the overall bodily process. So when these levels go down, there is increased cholesterol level in the blood. So, there is osteoporosis that's come up. Digestive systems goes for a toss. There are a lot of constipations that are happening. Urinary systems goes for a toss. Like the area becomes very dry. The lining becomes very thin. There are genital organs which changes their shape. The breast, the ovaries, the vagina, our general appearance, that is, our skin loses its elasticity. The hair becomes very dry. You tend to feel a lot of you feel dull from inside. Even from outside, there are a lot of things that makes you feel more you know, different about yourself, that I wasn't like this, my hair wasn't this, why they like this, why there is so much of hair fall happening. Yes, very rightly mentioned, hot flushes, night sweats, that happens. So that again leads to less sleep. Probably we say insomnia, or difficulty to go to sleep, or probably get disturbed sleep. Then there are a lot of psychological changes as well. Irritability, frustration, low mood, fatigue, insomnia. Then due to insomnia, a lot of other psychological issues. Then there are social changes as well. Because of your appearance, because of your irritability, you tend to go like, you know, you reduce going out, you make distance from the outside world. You tend to ignore a few social functions, or probably avoid them completely. So these all things, you know, these are the changes that happens in our body, which leads to lots and lots of other problems. So these are all interconnected. When we say that, this irregular periods or hot flushes or night sweats, these are happening, but these are just not happening. This is also leading to a lot of other causes in the body. So let's quickly see these first signs of menopause, these very rightly mentioned by one of our somebody has mentioned about it, like irregular periods, yes, insomnia, loss of sexual, there's a lot of sexual discomfort, loss of libido, mood swings, hot flushes, night sweats. Yes, these are all what we experience, and the rest of them which are actually happening, we are not even aware of them, which I mentioned, that there is a blood pressure shooting up, a lot of like thyroid problems, then rest I had already mentioned to you all. Now let's quickly see what are this. See, irregular periods. So irregular periods, what is irregular periods? So sometimes, you know what, the flow becomes very heavy. Sometimes the flow is very light. Sometimes there are like, for 15 days you will have bleeding. Sometimes there'll be like, for 2-3 months you won't get any periods. So that is a lot more disturbing because your cycle has disturbed. So your body is already getting so much changes. So it is very difficult for you all to take it. One thing, yes, of course, there are hot flashes and night sweats. What does that mean? So even when there is AC on, even the room is very cold, still you start sweating. You have like, your heart starts racing. You have, your face gets red. You start to feel like something very, uh, it's very difficult for you to sleep, and you even get very conscious about yourself, that somebody might have noticed what they must be thinking about me. My husband is next to me, he must be thinking, how am I behaving? All of a sudden something has changed in me. There is this, when we say sexual discomfort, yes, this again creates a lot of issues, because again, the male does not understand, and it becomes difficult for you to explain them. Even for that matter, even you are unaware what is this happening, why I am not comfortable on, like, having intimate relationships, or just like, there are a lot of mood swings. You are not in the mood. You have a lot of irritability. Even when somebody is, even on the small petty issues, you get very hyper, you get very frustrated, irritated. So, that becomes very difficult for you to explain, for you to also understand why this is happening. So can we quickly go to the next slide? So now, okay. So now in this, there are a lot of emotional issues that comes up because of these signs of menopause, like whatever changes that are happening in our body. This creates a lot of emotional issues, because one thing is that you are not able to understand that what is happening with you. And at the same time, you cannot explain. When you don't understand, how will you explain somebody that what is happening with me? So for some women's, the symptoms are like none. They don't have any symptoms. The menopausal phase is so smooth that they don't even understand that when did it come and when it ended. But for some women's, it is very, very difficult. There are, as rightly mentioned, that there are mood swings, depression, panic attacks happening, anger, short-tempered, irritation, crying. So you know what, like, for some women, it is usually the anxiety is present. Like, for example, if you have a meeting at work, or if you have a lot of guests coming over, so you have that anxiety, that whether I'll be able to. Menopausal phase, the anxiety turns to panic attacks. So this is not just a general anxiety. It's like, the intensity for everything rises during this period. So it creates a lot of confusion when you say that, you know, I'm not the way that I used to be normally. This is not me. What is happening? Even I don't know. Can we quickly go to the next slide? So there are a lot of issues that comes up. There is fights with with your family members. You get very irritable with your children. Keep nagging them. Then at work also you have a lot of anxiety, low self-esteem, low confidence, insecurity. That you won't be able to manage everything at workplace. You try to avoid situations wherein you have to perform, or wherein you have to wherein you have to do like you have to perform something. You're basically wherein your mind, your body has to give you a lot of sorry. So when you have to, I'm loss of word. You have to show somebody something. Like, for example, at workplace, if there is an meeting or a presentation wherein you have to perform, so that becomes very difficult for you to manage. If you have somebody to take care at home, if your parent is ill, or if somebody is ill at your place, if you have an adolescent children where you have to look after his studies, or if you have to take all the complete responsibilities on your head, so it becomes very difficult along with this menopausal phase. So there is a lot of irritation happening, and due to which this gives rise to, like, it piles up and increase the intensity of everything. Like, be a little irritations also can give, like, you engage into, like, there are many women who do get into divorce. They have they leave their jobs. They have they start having avoiding situations wherein they have social functions. They lose contacts with their friends. So there are a lot of things that happens. So let's quickly go to the next slide. Now let's come to this.
Just 1 second. Can everybody see the slides? I think Prachi has just mentioned that she cannot see the slides.
Yes, we can see.
Okay. Prachi, maybe you want to log out and then log in again. Maybe some glitch.
So should
Okay,
I
yeah,
wait?
please continue. Yeah.
Okay. You want me to wait for Prachi to rejoin?
Please continue. Please continue.
Okay.
She can see now.
Sure. Okay. So now let's see. We have understood that these are the problem areas. Now, how to tackle these problem areas? Now, you have to see. You have to understand this. This is a cycle. When you say that I'm feeling low mood, I'm feeling depressed, I have low self-esteem, this is just the feelings that you are sharing. Ideally, you're having, like, first comes the physical symptoms. So this is that you're feeling very tired, low on energy. Then comes the thought, I am not good enough, I am useless. Then comes the feelings. What is the feeling associated with this thought? Low mood, depressed mood. And then comes that you don't want to do it. So you either avoid it, or you withdraw yourself. You don't even attend, don't even attempt that. And then again, that leads to more tiredness and more loss of energy, because your body is making you feel more bad about yourself. You're sulking. You feel that, no, I am worthless, I cannot manage the simple thing. So this keeps on having a cycle. So usually what happens is you tend to ignore that thought. So usually it is like, I am not feeling good about myself. I am feeling very down, very low. मुझे काम करने का मन नहीं कर रहा है. I don't want to, do my daily routine work. I am anyhow managing doing these things. So usually you tend to ignore or you're unaware of the thought that is also very important. And see, where you need to make changes is very important to understand. Now, please, listen to this very carefully. This will really help you all. So physical symptoms are going to happen. This is bound to happen is because of this menopausal, premenopausal phase. Okay. So we cannot completely, work on that. Of course, there are a lot of treatments for that as well. But for the initial stage, if we are getting this thought that I am not good enough, I am useless. Now, you have to first think, is this what is end of your life? Do you have any evidence which says that, you are not good enough, you are useless? Do you have any proof, or were you earlier also the same? Is there anything you can do to work on that area? So we have to just check through that. So understanding your thoughts is really, really important. So now sometimes you don't, sometimes, it is very difficult for a human to understand that how do I, like, how would I know that what is actually bothering me? So for this, you can always consult a doctor, always consult a counselor, a psychiatrist who can guide you, you can guide you through the process. Counselors can really help you to rectify your thoughts. And then, so when the thoughts are rectified, automatically the feelings will get rectified. Automatically, when you have a proper behavior, appropriate behavior to it, when you are able to execute it nicely, you will have that sense of achievement that will automatically motivate you, and that will get that happiness, that smile. This smile just for an hour or two also is enough for this space. So we need to understand this cycle very, very nicely. Important. This is very important. Now, when women complain that they have irregular periods, so for that again you need to consult a gynecologist, which can prescribe medications appropriately, so that they can help you regulate your periods, and they'll make you understand your periodical cycles nicely. Now, what to do for hot flashes and night sweats? Do anybody here does anything for night sweats or hot flashes? Do anyone wants to share anything?
So Sneha, like I said, so I'm 46 currently, and since last 3 years, since 43, and my hot flashes have been so strong. Like initially, I would be using 4 to 5 ice packs on my head, because my head would be like spinning. It would be like needle, like pricking kind of headache. I would be rubbing plastic ice packs on my hand, on my legs. It used to be like that. Till later on, after a few months, then I started using some homeopathic drops. That really helped me. So that was in 2019, 2020. Last year was okay. This year again, I'm having a lot of hot flushes. I'm not using the homeopathic drops at the moment. But yeah, I'm drinking like literally all the bottles kept in the fridge are there in the freezer. So I'm drinking that. That helps a lot. As far as night sweats are concerned, in spite of the medication, I take only one thing, which is Menopause in the morning, that regulates the mood swing. Otherwise, no, that I would be screaming. It's literally like that. And for no reason, like you rightly said. And for night sweats, they still keep happening. So I do not know how to manage that. And I
Surely.
have to take medication to sleep in spite of the medication, allopathic and homeopathic, I still can't sleep. I keep getting up every 1 hour. It's like that.
Okay, so she very rightly mentioned, yes, ice packs helps you to avoid hot flashes, but yes, it's not the cure for it. And if you wear cotton clothing or very comfortable clothing during night, again, yes, cooling your pillow or having a ice bottle, yes, she's rightly mentioned this helps. Yes, homeopathic medications do help. Have you tried consulting any counselor for the same? Because see, this hot flashes is just the bodily thing that you have shared. There are a lot of psychological, things that your body must be working out, and that's how these things are, flashing at night. So you need to work on those areas. You can even try for yoga, meditation. Yes, that helps. But to regulate your thought, you will have to consult a counselor, because that is really important. Then for insomnia, when you have this hot flashes and night sweats, this create an hurdle in your sleep pattern. So there again, if you could make a it's if you could maintain a proper routine for sleep routine, wherein you have perfect timing, wherein you enter your room, the lights are off, you have the room temperature is maintained as per your comfort level. Then limit the screen time. Then again, reading or else soothing music, which helps. If you all like whoever, whatever, if you like reading books, you can go ahead and read book. If you like music, yes, you can listen to soothing music. Now again, when we say that it is difficult, even after that, still we have to maintain that routine every day. Like aaj nahi hoga, so let it be, I'll not try it again only. This is I know this happens, and then you tend to give up. Nahi, tomorrow I have a lot of work, how will I manage if I don't sleep on time, everything go for a toss. Relax, tomorrow we will cater to these problems. Today we need to work on our sleep. So very calmly, with affirmations help. Yes, positive affirmations helps a lot. Then again, yes, if you are having spicy food, then please avoid that. Alcohol, avoid alcohol, caffeine during the night time, basically. And for the medications, if you're on any medications, try to pop in the medications early on. And the next thing is you even have anxiety, depression that you mentioned, the low mood. That is again due to your thought and your because of the thoughts and these feelings. These are the feelings that you walking, having a stroll in a garden. Of course, it's again, if you all feel like, but if it is possible, go out, just have a stroll in the garden. If it is possible, talk to somebody, have friends, call the friends over or to your place. Have a diet is very important, exercising is very important. Then yes, if it, see, when we say it is anxiety, it is depression, okay, so these are all terms. When it is issue, when it is a problem area, when do we consult the doctor? So when it comes and interferes, if it is hampering your day-to-day life, that time, yes, you need to consult a doctor. So, initial stages when you're having low mood and you're able to manage it with few things, then it's great. If it is hampering your day-to-day life, yes, you need to consult a doctor. Now, see, these things you can manage, but there are a lot of things, like when you have a fight with your husband, you had a issue with your children, you have responsibilities to take care, you have immediate, you have somebody to take care, you have home shifting for that matter. So these all things again create an additional burden. You have some last minute at workplace, you have some last minute things to wind up, or you have additional burden at your workplace. Your boss is very difficult chap to handle. So these again will be additional burden during these phases. So when you have these phases, this creates stress. So when doctor says you have stress, so you say, yeah, I don't have any stress. No, my husband is very good. Everything is very good. My kids are also very good. They are doing their work nicely. I don't have any issues. My mate is very good. She comes on time. Everything is fine. What is happening? Nothing is wrong. These smaller issues also create stress in this period. Like just a small issue, that is what to make in dinner. Or tomorrow the maid is on a holiday. Now tomorrow I have workplace commitments and I have to be at home because a plumber is coming at home. So these all things, again, these are small things, but still these create issues. Because if somebody is if you are staying in a joint family and if somebody is taunting you, if somebody is continuously pointing out fingers at you that are itna hi to tha, you should have managed it. Nahi hua, it was not possible. So in this stage, what are we supposed to do? How are we supposed to manage? Karna kya hai? Chalo, we went to doctor, we did all of these, we wore light clothes, we had AC on, we did ice packs, everything is done. But now still it is not helping. Now what? Please, please, please talk to your family members. Can we please quickly go to the next slide? So what can be done? So information is the key. Please talk to the family members. They are unaware of what you are going through. So this menopausal thing, premenopausal thing, yes, you know, because you have visited the doctor. But talking to your husband, passing on the information to him. See, in our Indian culture, it is not very easy for us to discuss these things with our partners or with our children or with our family members, the rest of the family members. So, but if you do that, that'll be blessing for you, because they will know that why are you getting irritable every now and then. They will still understand what is your issues. At least they will be aware. This is bound to happen, so it's okay. We will avoid what she does not like. They'll try to make you happy. If you can take them along with they can accompany you to the doctors. Even for your children also, if they can accompany you to the doctors, it'll be a blessing for them. If whether it is a girl or a boy, it'll be helpful for them in future, in their future, where then they also have to, like, they'll be for a boy, he'll be having a partner. For a girl, she must be going through that, so she'll know how to deal with it. Nobody had taught us, but at least we can guide them. So if you accompany them along to the doctors, to the counselors, let it be a family counseling session. And once they are also prepared, it'll be really easy for you, like when you have that hot flashes, night sweating, you and if you are out somewhere with your friends chilling out, if they are females, probably they might understand. They are males, you might get conscious that but he must be understanding why I'm having so much of sweat. So if you are like comfortable in your shoes, if you have shared your feelings, if you have shared your problems with people around, then it won't be a problem area, because then you are free at your mind that yes, the other person is aware of what you're going through, so that won't bother you much. So that additional burden will come to an end. I'm not saying that the hot flashes will stop, but at least the additional stress that is producing, that will come, that will reduce. Then you have these books, you have the sites like Elda is there. There are a lot of other material that is available. Please don't give half information to anybody, but if you consult, like if Elda is doing beautiful job and they have a lot of information, so they can be helpful. Then see, menopause is an opportunity. So when you start eating healthy, when you maintain a lifestyle, when you have healthy routine for yourself, you go for walks, you start yoga, you start meditation, you have a healthy diet, exercising. So these things is going to help you better. So take this as an opportunity and not as usually we say, "Arey yaar, this menopause is hitting me hard. See, these things are happening." Instead, we can see that this is bringing a lot of changes in our body, and for some women, it is a blessing that it is end of menopause. Now I don't have to like for monthly I don't have to wait for my monthly periods and keep a check on them. No PMSing, no stomach issues, I mean to say stomach cramps or anything. So some women are very happy for that, but some women it is a very difficult phase. So we can take this as a challenge and accept this and take it as a new opportunity to have an overall development in our body, like a lot of changes that are taking place in our body. We can always regulate them, have a very good sleep cycle, have a very good eating habit. You can regulate, you can have a daily routine set. When there is a stressor, let's have a lot of affirmations handy. Whatever thoughts are bothering you, write them off, so that next time when you go to a doctor, you can consult the doctor, you have the thoughts handy. If you don't understand the thoughts, you can prepare yourself that what is the time when you start feeling low, so what happens during that particular time, so that this areas, when you start giving importance to your body, this is menopause is telling you, please give importance to your body, understand your body. And once you do that, you will be able to understand what and how things are changing in your body. So that'll be a very beautiful process if you try to do that. And yes, you can always consult and visit a doctor if it is difficult for you to manage. Now, quickly, so I'm done. So thank you so much for being so wonderful audience, being patient.